I'm Dr. Leslie, and welcome to Wellsprings Health, our Spotlight Series. Today, I'm with Dr. Andrea Orvieto, and we're talking about her acupuncture practice here in the Hollywood-Hallandale area. She has been in the community for almost 10 years and is a specialist in fertility work. So, something that's really interesting to a lot of our patients, fertility and women's health. Andrea, welcome. Thank you for talking to us.
Thank you so much. I'm so excited to be here.
Can you tell us about your background and what led you into acupuncture and what it's been like building your practice? I mean, for almost a decade now.
When you say it like that, it's kind of like scary, right? It's like, wow, that's a long time. So, my background, I have an undergrad degree in chemistry. And while I was in school, I wasn't exactly sure what I wanted to do. Initially, I wanted to do research, but as I was getting ready to graduate, I realized that I wanted to be with people and not behind a lab for forever. And so I took a little bit of time off and worked in between. I was a school teacher and I didn't really know what to do. But to rewind, before I started college, I used to get acupuncture regularly because I suffered from recurrent urinary tract infections. And the only thing that actually helped me get better was finally seeing an acupuncturist and a Chinese medicine doctor. But he was straight from China, came here. He barely spoke any English. And so young late teenager, early 20s me thought you had to be from China to practice this medicine. So never even thought about it. So as I was teaching, I was trying to figure out how I wanted to help people. I always knew I wanted to do that. And I I started the dietetics program at FIU and I was like, you know what? I love this field. It's just not for me. And somebody told me, hey, you could go to school for acupuncture. It was actually a cousin of mine who lived in San Diego. And she's like, and there's a great school in San Diego. And I was like, really? That's exactly what I wanted to do. So um, I, that was in March of 2012. And 6 months later, I was living in San Diego. And so yeah, I was there and my now husband and I met each other in California and we both are from South Florida. So when I was done with school, we decided let's move back closer to our family. I spent a year finishing up my doctorate in acupuncture and Chinese medicine while working at a physical therapist office as an acupuncturist. And then at that point I was like, you know what? I didn't only want to see pain. And at that physical therapist office, that's all we were treating. And so I left and it took me some time to figure out, but then I found myself here. And I still didn't focus on just women's health. When you first get out of school and you're treating, you want to help everybody and everything until something hits home. And I started initially, another acupuncturist told me that I should never focus on women's health and fertility because it's too much pressure. And so I really shied away from it for a long time until I got my first client that was having difficulty. And at that point, I never looked back. And then from there, I've started I see other things, but really focusing my time on um, fertility, women's health, perimenopause, menopause, pregnancy, postpartum, and a few years ago, I really dove into pelvic floor health as well. I have a very close colleague of mine who was a physical therapist, and she went back to school for acupuncture, and she solely focuses on that. And so she created a pelvic floor course for acupuncturists. And I think that anybody as an acupuncturist, any acupuncturist that works with women's health and fertility needs to also understand the pelvic floor. And from there, I sat for the acupuncture board of reproductive medicine, and I have a fellowship in that. And I focus between that and pregnancy, and pelvic floor is really the majority of my patients here.
So how does that overlap? Because I heard you say physical therapy a lot. Just shout out to the physical therapist. But how does that overlap, let's say, with other clinicians like physical therapy or the reproductive endocrinologist or the gynecologist? I'm sure your patients have all of those different specialties on board as well.
I am big on collaboration. I truly believe that the patient is our center of care, and there's not one modality that is going to just be it for our patients. It's a most of the time, I would say almost every single time, it's a multidisciplinary approach. And so I love to collaborate with other practitioners. I collaborate many times with OB-GYNs and REIs when I'm working with fertility patients, patients trying to conceive. And not all of my fertility patients are undergoing assisted reproductive therapy. Some of them are not there yet or may never need any, but still are getting blood work. As an acupuncturist in the state of Florida, I can actually prescribe blood work, like, write a script for blood work. But really, I don't do that because I like the collaboration of working with like minded practitioners. When I need to, I will through certain companies, but I think that we as practitioners have a respect for one another. I say to my patients, this is the blood work that I think should be done if it hadn't already been done. And with a lot of the OB-GYNs that I work and collaborate with, they are open to doing those types of blood work, whether it's blood work for recurrent pregnancy loss or baseline hormonal things or any type of blood clotting issues that that patient may have or may not have autoimmune. And so I really keep those OB-GYNs and REIs very close to me. In addition to that, I work with a lot of patients that are undergoing assisted reproductive therapies, and acupuncture complements them. It helps to increase the chances of conception or successes with these, whether it's medicated cycles, IUI, or IVF. And again, I don't step on toes. I stay in my lane as a practitioner, and I help guide my patients as well. I think that there's a big disconnect, not with all, but with a lot of large IVF or fertility clinics of communication. And if you don't understand the world of reproductive therapies, you don't know the questions to ask as a patient. And so I try to fill that void and that gap that there is because these doctors, some of them are unbelievable practitioners, physicians, but the communication goes through the office a lot. And the communication is not good with the office staff and my patients, and it adds another layer of stress. And so I try to answer the questions that my patients may have that haven't been answered, or guide them to ask the correct questions or appropriate questions to advocate for themselves. As for collaborating with physical therapists, I love that. Physical therapists in your scope of practice, you can do internal work with the pelvic floor. And as an acupuncturist, I cannot. And so I think that the approach together, I can get into the emotional and spiritual, emotional aspect of a lot of pelvic floor dysfunctions. In addition to that, I'm sure, so there are some really powerful points and approaches to the pelvic floor, and not just straight to the pelvic floor muscles, but those muscle groups that lead to the pelvic floor in the abdomen, in the back, in the glutes, in the inner and outer thighs, the adductors, abductors, all of that, that with acupuncture needles that we can really use and address to help with the treatment of the pelvic floor dysfunction, whatever that issue may be. And so I collaborate a lot with physical therapists and other types of therapy, whether it's pelvic floor solely related or pain. I also collaborate with chiropractors. So I think a multidisciplinary approach is the only approach that there should be. It shouldn't be just going down one lane. I don't know. We all have
Oh,
our
that's fair.
specialties that we can, um, eh, that we all have our specialties that and our modalities that we can bring to the table to just help elevate the treatment for that patient, whatever the concern may be.
We say around here it takes a village to treat a patient because if anyone that thinks that they can fix everything probably is missing something. Um, what does acupuncture do? What can you do with these needles? Because there is a difference between dry needling and what you do. And you're working with a totally different body system than a lot of us are aware of.
Yes. So I obviously acupuncturists can do dry needling because it's just the dry needling is going into those specific muscle groups. And we have many ortho classes that we take in school and after school, like continuing ed. As for the system of acupuncture, it is extremely complex. It is a science and it's also an art. There's this synergy with the science and the art that comes together, and it's sometimes really difficult for people to understand. Even as an acupuncturist, sometimes I do something and I was like, "Oh crap, this actually works. Oh my gosh." Like you remember again that, wow, I helped this person and this happened in that sense. So, how I like to explain it so that people can understand it is you can think of your body as with acupuncture meridians, you can think of the acupuncture meridians as highways and streets in a city. So the highways go, through our bodies, and we have these streets, these entry and exit points on and off the highway. Let's say there's a crash on the highway, which we know happens a lot in South Florida, and we understand that it doesn't just impact that specific area. It backs up to the on ramps, exit ramps, and all of the surrounding streets that are near there and even not near there because we have detours and all of that. So think about the acupuncture needle coming in as the ambulance or the police and kind of clearing up that clog, and so that the highway can function the way that it should, and then all of the other streets can also function the way that they should. That's really how acupuncture works through the body. So sometimes our bodies we get headaches, or pain, and we're not exactly sure where it's coming from, but our bodies should be able to innately address pain, address headaches. But when we have something else stuck somewhere, and we can use the term energy for simplicity, it's our body's not able to get to address those headaches or that pain. And so the acupuncture needles come in and help the body to function so that it can go back to being innately able to address those headaches and address the pain. Obviously, with fertility or with pelvic floor dysfunction or more complex things, it's more complex than that, but it's simply that.
And I think people consider acupuncture, if you don't know better, you think of acupuncture on the woo-woo spectrum and the complementary therapies, the alternative therapies. It's an entire system of medicine in other places, thousands of
Sure.
years worth. And a lot of good peer-reviewed research
A ton.
in Western culture as well that is now proving what other clinicians have known for a long, long time. I know that when I was going through IVF, I used acupuncture both before and after my
I love
transfer
that.
and through my entire first semester. And I mean, who knows what does what when you have a lot of cooks in the kitchen, but I really credit it with keeping me very comfortable and happy during my pregnancy.
Sure. It is complex. When I was in school, we understand research is necessary. There's a lot of information that we get from research. Research takes a lot of time, and we also understand that research takes a lot of money. It takes a lot of money and time. And when I was in school, there was not nearly as much research out now. Acupuncture, unfortunately, doesn't bring in a ton of money in the sense of being able to fund a lot of this research, or it didn't when I was in school. We're seeing more and more coming out, not just with fertility. We see a lot of it when it comes to, well, we could talk about it with fertility like challenges. There's a lot of research that comes out with how acupuncture helps increase the rates of successful transfers. In addition to that, it can help with patients that deal with endometriosis. We show that, endometriosis is an inflammatory condition, and acupuncture is superb at decreasing inflammation and other things. It's not just acupuncture, Chinese herbs, um, Chinese medicine is the umbrella. Acupuncture is just one of the pillars under the umbrella in the whole scheme of Chinese medicine. And so there's research that comes out about endometriosis, about even insulin resistant PCOS, and how acupuncture and Chinese herbs and modalities under acupuncture can help with that. So it can there and now there's more and more research coming out knowing we know as acupuncturists, because that's what I didn't go. I always tell people, they always ask me like, "Do you believe in it?" And I was like, "Well, if I didn't believe in it, it would be really silly of me to have gone and spent hundreds of thousands of dollars of schooling and years of schooling to go
Committed
into
a career
something."
to it.
Correct. It's just a hobby. It's that's it's, are you still doing that's like the story I told you, is are you still doing that acupuncture? It's like it's so much more than that. And my patients will come in and say that, "Oh, I don't really believe in it." And I tell them all the time, I said, "You don't need to. I there's more to it than just believing. Believing in it just allows you to relax nicely in the room of like, okay, I'm doing something for this, but there's science, there's research behind it. There's thousands of years ago, they didn't know which organ was where and what was happening, and they didn't know exactly how to call it. But now as research is coming out, we're seeing there's so much similarity to what we're saying in Chinese medicine and a lot in Western medicine of the nerves and how things flow in the body. So it's very interesting to see that coming out as well.
If somebody wanted to do something for themselves that didn't involve going to see you in the office, but let's say was in keeping with traditional Chinese medicine, what would you recommend for self care? What's something that we can do simply at home that will complement something you would do at the office?
So there's acupressure. So we have so many points on the body that can correlate and help with many things, but stress. There's so many points on the body that can help with stress or major headaches. Acupressure is really a great practice. Obviously, it's not as powerful as acupuncture because there's a difference of actually inserting a needle versus pressing on an acupressure point. But let's say, for example, you know, the people that get seasickness, they have those bands, those bands that have like a little button and it pushes it. That's an acupuncture point that we use. It's pericardium 6. That's the acupuncture point. That point we use for nausea. I use it with my patients that are in their first trimesters of pregnancy for nausea, or somebody that may have nausea for other reasons. That's just an acupuncture point. It's an acupressure, but it's marketed differently, because if you see where the point lands on that bracelet, it's right on pericardium 6. People use acupuncture, and not knowingly. Things
So
like
what's
that.
the
We
point
also
for stress relief?
exactly.
So which one? Tell me, I need it.
Oh, chest relief? Actually, pericardium.
Stress relief, stress relief.
Yeah, stress relief. Oh, okay, I thought you said chest relief. Um, Heart 7 is a great one. That's like I like to give out easy points that you can like massage. So that's like right under um the wrist, like, if you follow your pinky down here, that's heart 7, and that one I use a lot. I mean, almost on every, patient of mine that is that is going through dealing with stress, which is majority of them, but especially trying to conceive. Um, where else do I like to use? Up in up on the top of the head, there's, do 20, and so I don't know that this is as much like stress relief, but this is really calming, and also it can bring clarity to the head, and also it is calm. It can be calming, and nice if you massage right up there. It's usually pretty tender for people. I like to use like for headaches, or even just like if somebody is anxious or they are irritable is maybe a better word. Um, and possibly have a headache as well. Li 4 right here in between the index finger and the thumb, where it's pretty tender, and a lot of acupuncturists use this point. It's a really nice point for really relieving some irritability, but also if somebody has a headache, it's a good point for headaches as well. There's ear acupuncture, and so you can put ear seeds and go home with some ear seeds. They're like little stickers, and I use that a lot for stress and resetting the body, kind of the nervous system. I really like ear seeds, but also something that's really important in Chinese medicine. is nutrition. And in Eastern medicine, we love to focus on warming foods. We don't, you won't really see many acupuncturists eating salads or smoothies or raw juices, a lot of raw vegetables, things like that. Everything is nice and warming because that's excessive raw can be very taxing on the digestive system. And then it can just tax the rest, like it can make you more sluggish, tired, fatigued. And so you'll hear us talking a lot about like bone broth, oatmeals or congis, which is like rice. It's like oatmeal but made from rice, stews and soups, which is hard to think about because we live in South Florida, but I like rather cooked vegetables. If people are insist like have to have a salad, I make sure that it's not every day, but also warming vegetables inside of the salad, not just a raw vegetable salad, if that makes sense. So those are things that people can do at home. We're a lot about warming and keeping the body nice and warm. Obviously, there's some people that are not, that are the exception of the rule, but the majority of us are overworked, overstressed, overeating, over all of those things, overweight, and can use some of most of people can use those pointers.
And what do you do? I mean, you have all of the knowledge and all of the tools. What do you do outside of work to stay grounded? Do you do acupuncture on yourself? Do you work out? Do
I
you do
don't.
your acupuncture points?
So I I do work out. I have to work out. It is the best thing for me. I also go to the chiropractor. I don't get acupuncture. Sometimes I'll do it on myself, but it's rare. I'm very particular with who touches my body. I think that the energetic transfer is very powerful. And so whether I'm seeing a physical therapist, which I've seen in the past and I will see in the future, a chiropractor or massage therapist, I'm very particular with who I allow to touch my body because it is an intimate thing. The energetic transfer is real, but I do see a chiropractor consistently. And now it's like monthly, but if I need something, that's my go to. I get a massage usually once a month. I do take care of my body in other ways. So I don't always get acupuncture, which I wish I did.
Need another you.
But if you find one, let me know.
Yeah, I will.
Yeah. But
Thank
it's
you very
important for me to keep myself grounded. I work a lot and I love what I do, but it's still, I treat things that can be very heavy and are very heavy. And as high as the highs can be with my patients when they get pregnant and they have a successful pregnancies, the lows are very low as well. And I'm an empathetic human. And a lot of people, I feel that most of us that go into work like this are very empathetic, and we have to learn how to separate ourselves from the heaviness that can come in the office. And it's taken a long time to be able to do that. And with the heaviness of fertility in the office, I have to learn, how to balance that. And I have over the years, and I'm sure that will always evolve and new things will come. And the way that I ground myself may look a little bit differently.
Yeah, it evolves as you do.
Yeah. I'm sure you have your practices that you do.
It, to your point, when you're very invested in what you do, and you're very connected or you want to be very connected with your patients, and that's part of the care that you provide, the exceptional care that you provide, something that sets you apart from other practitioners. That's how we try to be also. And we all get into this because we cared a lot. it's, um, you do need to have the self-care. I think everybody needs those self-care practices, but to stay strong and stable and grounded for our patients so that we can continue to do the work that we do. It's very important.
Sure. And I sleep. I know that it's so cliche to say, but I I really take that part seriously of going to sleep at an appropriate time and getting um quality sleep overnight, as I'm a mom of two young kids, and um for the first I mean, up until recently, I wasn't sleeping because I had a child that didn't sleep, and then I had another child that was breastfeeding, and I breastfed throughout the night until he was like 2.5 with my like, it was my choice, and I loved that. But you don't realize the impact of interrupted sleep or low quality sleep has on you. And last year in May, around Mother's Day, I invested in an Aura ring because I actually wanted to see what my sleep was like. And my brain is currently so much more clear than it had been. And so something as simple as that, I take that. I'm very selective on how often I go and socialize because I know that the next day I'm going to be kind of off. So sleep to me is very important as well. Yeah.
And I think the work that you do helps people get better sleep, would you say?
I agree. Absolutely. The work that I do, I have patients that have brought in people because when they come into the office, they are able to relax. And a lot of my patients, I would say the majority of my patients fall asleep in the office. And a few of them, but one of mine was able to convince her sister to come in, who is deathly afraid of needles because she's like, I napped. And this is somebody that she could be alone in the house, lights off, could never nap. And the fact that acupuncture was able to put her in such a relaxed state to nap, it convinced her sister to come in. And so it is very powerful. The acupuncture, no matter where you put a needle, it triggers that parasympathetic nervous system. It releases endorphins, it releases serotonin, and that's why people leave the office feeling that high, like you've just taken a really great yoga class or a workout class, that runner's high, is because it literally does that. And obviously, if you have a pinpointed treatment that's right for you, you feel even better when you leave. So
It is true. That's why I like
it
it.
is true. I know. I should get it one day.
I feel like you should try it. It's really great.
I do lay on my bed sometimes here and just relax, and I was like, "Oh, this is what they feel like."
Yeah. Enjoy when you can.
Exactly.
Thank you so much for your time. I know you're about to go in with an afternoon of patients, but I really
I am.
appreciate what you do and a little bit about yourself. I think it's nice to humanize the clinicians that we work with and realize we're working with
Always.
real people, real lives, real families doing it from passion because we really care about it. And that's what we value and the people we refer to in our referral network, which is where you come in. So thank you very much.
Yes. No, it's true. I love what I do. I know you love what you do, and it's important that people recognize, and I think most of our patients do, but on the outside recognize that we're doing this. Yes, it's a career and it's our business, but we got into it and we are doing it because we are so passionate about how it can help others.